Hello and welcome to a very special edition of the Tech Glow Up. This week, I'm featuring 5 innovators who just recently won awards and notoriety at the HealthTech Impact Showdown, a project that Sabrina Runbeck shared with us a few weeks ago that helps new entrepreneurs hone their pitch, get in front of the right kinds of funders, and compete in a game show style setting to share their company and meet the right people. So we have 5 winners that I'm really excited to share with you. Each will have a dedicated segment and will share more about the work that they are doing in health tech innovation. First, Ellyn Ito of InnerStill shares her pitch for MindVybe, a patented neuromodulation device, a piece of hardware that uses low-intensity electronic stimulation to help regulate your nervous system and give you a feeling of grounding relaxation. Alex Koshykov of YODD introduces us to a new multimodal testing device that allows patients to take a lot of biometric data and share it with a primary care physician instead of traveling hours and hours. This innovation looks specifically to help with access to care as well as speed to care in rural populations. Super cool. Claire Dixon of Neuraura discusses her LoOop product, a hardware innovation focused on relieving the symptoms and discomfort of PCOS, a condition that causes a lot of pain and discomfort for many women, yet has been understudied. LoOop is both a abdominal patch with electronic stimulation and a platform that helps fill in gaps in the care cycle with things like a knowledge base, personal journaling, and an AI chat assistant to help you through your care journey. Dr. Chigozie Nwalozie of Zarephath Health describes the rapid, non-invasive, urine-based tests for HPV, STDs, and many other markers, delivering results in as little as 10 minutes and transforming what is possible for remote care in Africa. His efforts are expanding access to care across a 16-country territory. Fascinating. Tayaru Bayyana of SereniCare AI outlines her proactive decision platform that makes cancer care both more transparent and more empowering for both patients and caregivers alike. Inspired by her father's own struggle with a stage 4 cancer, SereniCare AI looks to improve that patient journey by using data to help everyone make more empowered and proactive decisions. This episode is full of personal stories and powerful new technologies and quite a few different healthcare technology hardware devices. Really cool to meet these global innovators who won at the HealthTech Impact Showdown Awards. Thanks so much for joining and listening. I hope you enjoy meeting all 5 of these amazing winners. Congrats to all. Hello and welcome to a special edition of the Tech Glow Up. We're here with the first of our HealthTech Impact Showdown award winners. And today I'm talking with Ellyn Ito of InnerStill. Ellyn, thanks so much for joining me on the Tech Glow Up. I'm so glad to meet you and your work.
Oh my goodness, thank you.
So to get things started, congratulations. You've just recently gone through the HealthTech Impact Showdown. You honed your pitch, you gave it in front of a board of experts, and you came out a winner. Can you, for those of us who haven't met you yet, can you please introduce yourself?
Sure. So I'm Ellyn Ito. I'm the CEO and co-founder and investor in InnerStill, and we are launching Do No Harm platform, neuroelectric technologies for both wellness and clinical care.
Oh, I'm interested. Tell me more about InnerStill. You've just been working on through the HealthTech Impact Showdown. You've been honing your pitch. In a couple of minutes, can you introduce the work that you're doing at InnerStill?
During the pandemic, my 15-year-old son became suicidal, and nothing we tried seemed to help. And so I went searching for solutions and found the answers in my co-founders who were brilliant. And together we formed InnerStill. So we're addressing the root cause of dysregulation. And so millions right now are seeking side effect-free solutions to address stress, mental health issues, or neurodegenerative disease. And most solutions today focus on symptom management versus root cause remediation. So our first product is MindVybe. It is a patented vagus nerve and acupressure point regulator, and it's launched as a wellness product through wellness practitioners and high-intent premium consumers and organizations who are looking to elevate mental resilience. It gives the 217 million biohackers the edge, and it's also a solution for the millions seeking relief from stress, poor sleep, agitation, lack of focus, and brain fog. I mean, can you imagine a team finding relief without the ups and downs of managing meds? It was a reality for us. We will take a version of MindVybe through a 510(k) FDA pathway so we can expand access, but right now it's launched as a wellness device. And we're seeing traction with over 5,000 users, 4 clinical studies, and early revenue through practitioners and those organizations and educational institutions. Our work has won 3 state innovation grants and recognition for its community impact. But we're just getting started because that's MindVybe. We're also advancing a patented non-invasive deep brain system to improve symptoms of dementia, with early experience showing delayed progression and restored function. More studies need to be done, but it's exciting. Unlike other neuromodulation devices, there are no side effects to date, no uncomfortable sensations, and no muscle twitch. There's no risk of overuse or what they call saturation. And there's no need to set parameters because our tech auto-regulates for the individual. We've raised $1.3 million in safe funding to date, and we're now raising a $10 million seed to scale our wellness commercialization MindVybe and advance our FDA platform. And so when we think about the future of health and longevity, it's no longer just symptom management. We're seeing too many downstream effects from just treating the symptom. It's about safely restoring the systems that regulate mind and body at the root. So learn more and come join our mission. We invite you to vibe.
Oh my gosh. Ellyn, I feel like you might have been an industry plant because like you're speaking to several of like my passions and the things that I rant about. Okay, there are a couple things that you called out, right? That like the combination of isolation, of digital overuse, of like pandemic level fears that students today are facing has just in the last 6 years transformed the mental health landscape and challenges for youth from 4 years old to college age. Like that entire generation really got hammered. And I honestly don't think we talk enough about it beyond the like, oh heck, what can we even do? That must be awful. And so thank you for taking action and, building solutions to this thing that is amazingly underaddressed. What I really want to get into though is tell me more about how a piece of hardware is going to understand my mode, my mood, and help me start to regulate. Can you talk me through what's the experience like? Is it haptics?
Sure.
Is it sound? Is it light? It sounds like it might be all 3. What are we looking at?
So MindVybe delivers ultra-low electrical current. So in frequencies that most people feel nothing. And the way that it auto-regulates, it's optimized for about 85% of the population, the frequency ranges and the waveforms that engage the rest, digest, and recover function of the nervous system. And so by delivering these ultra low frequencies in a format and an algorithm that auto adjusts to each person's own skin impedances, everyone has different moisture and thickness and musculature. And so what our technology does is it basically auto-regulates for the individual. And the reason why that's important is because it's impossible to know what you need versus what I need just based on how much sensation I can tolerate. The other important thing about the technology, there are other stimulators out there on the market, and they do have efficacy. What's very unique about ours is that it is multi-mode, not only vagal nerve stimulation, but acupressure point stimulation. But there's also no risk of overuse. What that means, it's designed for use as often as needed. And what we find with other technologies is you can be on it for a while, it works, it seems to be great, just like medications, it works. And then after a while, the effect seems to lessen. In this case, our technology is there when you need it without that risk of saturation.
How would I use it? What is it like when I use it? How long does it take? Where do I do it?
Yeah. So right now we've launched through various practitioners who are focused on wellness and resilience. And so you would go into their location, whether it's a wellness spa, an employer's wellness location, and you are connected to the machine. It is a 50-minute session where you can work, you can sleep, you can meditate, you can have a meeting. You do not have to interact with the technology. You do not need to interact with the technology for it to interact with you. And so that makes it very fun for people who are very, high performing. I don't have time for this and I can't medicate because I have too much to do. You put them on the machine. They're on their computer typing away. And after their second or third session, they close and they're able to kind of sit quietly. Because in this day and age, with cognitive overload, we did not evolve as humans to be bombarded with artificial light and constant news and all of this stimulation. And what we know now is that by engaging that rest and recover function, that quiet space, it creates balance within the neurochemical aspects of the body and everything works better. This is not me saying that. This is shown in our studies and other studies.
Ellyn, I'm way too interested for the time we have today. So you forgive me if I have to kind of move on a little bit. So you've already shared that you have a pretty ambitious roadmap and you have some big goals for what is the glow up or notable transformation that you're looking to make in the short term, say like 3 to 6 months. What's your startup glow up that you're working on?
So our startup glow up is to partner with impact investors who are passionate about our space and making a difference in the brain health economy so that they can work with us to expand our market and are excited about not only nice returns for their shareholders and themselves, but also impact to the communities that we're serving, impact to all stakeholders. So that glow up for us is really expanding our community beyond just our practitioners and our researchers. We want to expand it so that people understand that there's another way to improve brain health without side effects. We want to expand our impact by helping people to understand that there is a first line offense to helping to restore balance in the brain and body without first having to reach for a pill or a more invasive option.
Yeah, I mean, Ellyn, I have incredible ADHD and like the anxiety to match it. And regulation is like a constant struggle. And as like a professional in today's world, right? Like I feel as the day goes, like slowly becoming like an email golem where I need to just like engage with my precious, communications. And that is when I know that like, hey, I've learned over lots of practice that that's when I'm dysregulated. And like, hey, you should go take a walk. Hey, like you need to get back into your flow, into your strategic brain, into your body. And for me, one of the right, like learning that moment was key, but learning how to disrupt that feeling before. And the thing that I love that's this underlying subtext is right, you can disrupt it when you need to. You can take a break when and where you need to. And that there's not this risk that you have to be, what do we call it? They have to be like saving it, for those moments of repair, that this is something that you could
Yeah,
ideally build into your day and use to both understand your
that's right.
regulation and to maintain it where you like it. So fascinating.
Yes. And the other beautiful thing we're seeing with our users is that once they understand what that calm feels like, they're able to employ other tools to get there. Like so many people have said, oh, I wonder if this is what meditation feels like. Well, now they understand that calm. It's easier for them to get there. The other cool thing is as people understand and start to feel that balance and get into that quiet space, we get comments all the time that people feel like they're more creative or more productive or even more intuitive. And there's reasons why that is. But this is why we're so excited and I'm so passionate about
Yes.
MindVybe. But then we have the other for
We're
neurodegeneration.
going to have to bring you back on to talk about neurodegeneration because, right, one of the like successes in healthcare in my generation, like in my lifetime, that I'm just astounded by is that like Alzheimer's became a disease and there are now multiple cures and treatments in the market. And it was like the most scary, terrifying thing ever when it first came out. And to have that kind of hope and treatments, is so crucial. I'm really interested in hearing the stories that make innovation work. We hear so much about the successes, the press releases, the announcements, but like the hard work and the good advice that actually makes the difference is where I'm so interested. And as a founder who's like working with working with customers, who's got thousands of Vibers out there in the world, who's got this ambitious plan and has already had some notable funding. I'd love to hear, what's the advice that's been important to you on your journey? How have coaches, mentors, or other people advised you on your journey as a entrepreneur?
Wow. So there's one mentor. His name is Dov Barron. He has just picked me up when I've been at my lowest. And he's my biggest cheerleader. And I've seen him work with so many others, but he really has impressed with me to stay true to the values. Stay true to the values of why you are doing this, but also stay open to feedback. And as a founder, and most founders know this, that, when you are, raising money, you're having to prioritize spend. Sometimes you have no money in the bank account and you're maxed out on your credit cards. Do what you can with what you have to move your mission forward and never give up. Because if this is your passion and you see the vision and the value you can provide, never give up.
I can't tell if that's the mic drop moment at the end or if we put that at the front to get people to listen. The idea that I fell in love with when you were talking about this idea is that you have to believe in yourself and also be open for feedback. And that is such a challenge, right? When the feedback doesn't match the vision, that can feel like a failure. This idea of like, every day is a day you can work on your business. If you know that it has that transformational power, like believe in it and work on it every day at the level you can today. What fantastic advice for founders at any stage. I so appreciate that, Ellyn.
No,
So,
absolutely.
go ahead.
I was just going to say, and that's the biggest challenge, right? Is knowing when to move your ego out of the way and the fear that you might have, and really being open to those ideas of what might matter and being able to tell, does it align with the values and your vision?
If we're being honest, it's probably your ego's fear, not like actual fear.
Yeah, sure. Absolutely. That's exactly right. As our other founder says, fear is false evidence appearing real.
So, Ellyn, it sounds like you have done one of the things that all smart founders do, which is surround yourself with really great advisors and people who sort of match the skills and gaps that you have to be there for you when you need it. So, bravo there. Ellyn,
Great.
I'm curious if folks want to learn more, find you out in the world, how can they learn more and connect with you?
Check me out on LinkedIn, message me there. You can also go to our website, www.innerstillhealth.com. Our product website is www.mindvybe.com. We welcome and are open to any questions.
Ellyn Ito, CEO and co-founder at InnerStill, launching their MindVybe product and changing the way that professionals all around the world can self-regulate and get that feeling of calm. Congratulations on your recent win on the HealthTech Impact Showdown. And thank you so much for sharing your entrepreneurial journey on the Tech Glow Up.
Absolutely. Well, thank you, Nathan. I really appreciate it.
Such a treat. This is another special episode from the HealthTech Impact Awards. And today I'm talking with Dr. Chigozie Michael Nwalozie of Zarephath Health. Dr. Chigozie, it is such a pleasure to meet you. Thanks for joining me on the Tech Glow Up.
Thank you, Nathan. It's amazing, and I like being here. Thank you.
Can you introduce yourself and your role at Zarephath Health?
Thank you so much. My name is Dr. Chigozie Michael Nwalozie. I'm a medical doctor by training, an educator by passion, and I am the director for West Africa at Zarephath Health.
Amazing. Congratulations on your recent win for the HealthTech Impact Showdown. Could you share the pitch that you've been working on that brought you to the winner's circle?
Okay, thank you so much, Nathan, once again. Zarephath Health is an African diagnostic company. We were founded in 2019. It is headquartered in South Africa and Zimbabwe, but anything on the West African side is under my care. Now, most recently, we are actually undergoing a validation studies for two of our test kits. You can see this is the HPV urine rapid tests, okay, as well as the 3-in-1, but this is the system one I have here, the 3-in-1 STI urine tests, okay, and these are urine-based. Why is this important? It is non-invasive, it is rapid, and our test results come out as early as 10 minutes. So, 3 pathways we're looking at: early screening and treatments. That's the pathway. This day and age, we see in an African setting, most of the tests are invasive. That is not what we are about. And then it will make these women or these ladies to have a second thought. Should I go for this test? Shouldn't I go for this test? Check something like pap smear. My apologies to the female folk, but you see, it is invasive. But our tests, these are urine-based. All you need is a urine sample. First void urine sample, and then our result come out as early as 10 minutes. So we are doing this, and there are 16 countries that are involved, actually. They've been saying, okay, they're interested in coming on board, which is not a problem. But right now, we've kicked off with 16 countries, cutting across Southern Africa, Northern Africa, Eastern Africa, Central Africa, and West Africa. So we've been doing this, and then we are saying that governments, leading funding partners, and institutions should come on board for us to do this together. One logic I always put out there is this: why do we have to compete when we can collaborate? Okay? When you collaborate, you go further. Now, an African analogy goes this way. Nathan, when you want to wash your hand, imagine doing this. You cannot wash your hand with one hand. It will not be effective. But look at this. When you wash your hand this way, how effective can that be? So what does this tell us? We need collaboration in what we're doing. So we are opening our doors for governments, for civil society organizations, as well as anybody who's interested in what we do. Now, I really want to also say this, that these are what we are looking at, okay? But then the HPV urine test and the STI 3-in-1 urine test for chlamydia, gonorrhea, and trichomonas. This is what we are projecting out there. But our test portfolio cut across a whole lot of others. HIV, syphilis, hepatitis B, hepatitis C, cancer markers, and the rest. Thank you so much, Nathan.
Yes, Dr. Chigozie, I'm really, my brain is going wild with the possibilities and what 10-minute rapid testing in a non-invasive way means for your patients, for the people that you care about, this whole west coast of Africa. Can you talk about what does it mean, especially in the terms of these partnerships? How is a 10-minute rapid test changing the game for doctors that you're partnering with?
Look at this. HPV is a global issue, right? Now, in an African setting, be it remote, be it in a very standardized technological setting, our rapid test can work. Now, imagine you go to a healthcare provider, you do the test, and then your test results come out as early as 10 minutes. I'll give you a typical example of a problem in an African setting. Now, some of these people in the rural communities do not even have access to healthcare. Access is the problem, okay? The science is not the problem, but access is the problem. Most of them live in areas where there's no communication. Some of them don't even have a phone. Some of them don't even have electricity. So how will you reach out to them when the test result is going to take so long? Come on, it doesn't make sense. Let us all put on our thinking cap and look at the logic. Look at this. You come to see me, I screen you, your result is out under 10 minutes. You are still standing there. Diagnosis is done, and you're on your path to treatment within a short period of time. Let us use something like the pap smear and the rest. Some of these results come out as late as days or weeks. Now, how can you get a woman who came for a test in a remote area to come back for a follow-up after a long period of time? Okay? Some of them will not even have the time to come back again. So you lose them once, you might not get them again. So that is why we say rapid testing as early as 10 to 15 minutes is the way to go. Thank you.
Thank you for sharing specific. I was guessing specifically that follow-up care was going to be a big pain point. And right, I love that you're taking something that might like extend care into weeks or months, you know, to get back in touch with people, to you have the results today while you're still in the appointment with your caregiver. I love it. So, Dr. Chigozie, can you tell me, the show is called The Tech Glow Up, and a glow up we use to talk about transformation, we talk about growth. I really love to use it in terms of 6-month goals. So for somebody who has such a broad audience and some highly impactful technologies, what's the goal that you have in the next 6 months that you're working on?
Now, we are talking about screening. Okay. Now, the goal is to be able to reach out to more people, not just in Africa alone. Okay. We are trying to establish relationships, partnership across the world, be it in Latin America, be it in any part of the world. One thing I want to put out there is this. HPV, can affect anybody, anywhere. It is not a respecter of your name, your gender, your age, your status, whether you have money, whether you're poor. No, it's no respecter of anybody. We're looking how best to actually go from actual screening to proper execution and scaling, not just within our locality, but beyond that. And then the 16 multi-country study, we're looking at partnership, not just for the 16 countries, but for more countries to come on board, countries or people that see the need of what we're doing and then resonate perfectly with our work. In the next few months, we expect that we must have scaled through beyond Africa, have a perfect partnership, and especially with lead funding partners, be it governments, organizations, and the likes.
The last question that I've been asking, I'm really fascinated, especially with like doctor innovators, that, you know, the great advice from mentors, from coaches is something that every innovator, you know, talks about as instrumental on their journey. And I'm curious, can you share what has been the most important piece of advice you've gotten in your journey as an entrepreneur?
I'll say this fairly for all of us to get it perfectly. There's this saying, execution matters more than ideas. Nathan, anybody can have an idea. But the point is, what have you done about it? You have an idea, nothing is done about it. We have the idea, we are doing something about it. And what are we doing about it? Execution. That's what I'm saying. Execution is what's more than idea. So it is important for us to focus on the real problems. We know what the problem is, and then we are focusing on it. We are bringing solutions. We are making a difference. And the three guiding lights of our pathway is what? Screening. It should be early, accessible. Diagnosis. Again, it should be very easy for us to get and should be clear. And finally, treatment. The three pathways clear anytime. Screening, diagnosis, treatment. Very clear. It makes a very big difference. And above all, we are looking at the right partnership. As I gave you the analogy from the start, I said, competition helps no one, right? If we both collaborate, we are going to make a massive difference globally. So this is not just an African thing. I must state this clearly. Because most times, because our company is situated in Africa, we think, okay, it's just an African thing. No. So let me just take it back again and say this. HPV do not respect your nationality, no respect of race, no respect of your name, whether you're a president, whether you're a senator, whether you are a common man, doesn't. No matter how much you have in your bank account, it doesn't respect that. So please, let us come together, put our hands together, and see how best to make a global impact. Thank you. Peace.
Dr. Chigozie, Michael Nwalozie, such a pleasure to learn about the rapid testing that you are doing at Zarephath Health and how you are building both access and immediate results for people who are really struggling with both of those things in healthcare. So it's hard to disagree with that. Easy access to fast results is really should be a right when we think about healthcare. I can't wait to see how you grow this mission beyond the west half of a very large continent. And I can't wait to watch as you glow up the work that you're doing at Zarephath Health.
Thank you so much, Nathan. It's good to know. It's good to hear.
Yes.
That.
Thanks again for joining me on the Tech Glow Up.
Thank you so much.
Oh, you know what, Dr. Chigozie, there's one question that I totally forgot to ask. If people want to learn more about the work that you're doing or want to talk about a partnership, what's the way that people can learn more about your work?
Okay, we have a website, www.zarephathhealth.com, or you can email me directly, Dr. Michael at zarephathhealth.com.
Yeah, we'll put it in the show notes for sure.
Yes.
Well, Dr. Chigozie and Michael, it's been such a pleasure to talk with you. Thanks for joining me on the Tech Glow Up.
Thank you so much, too, Nathan. It's wonderful to be here.
Today I'm talking with Claire Dixon, another one of our HealthTech Impact Showdown pitch winners. Claire, it is such a pleasure to meet you. Thanks for joining me on the Tech Glow Up.
Thanks for having me. It's awesome to meet you too, Nathan.
Well, let's get into it. Could you introduce yourself and the work that you do at Neuraura?
So I'm Claire Dixon, CEO and co-founder of Neuraura. Our solution, LoOop, is tackling PCOS, polycystic ovary syndrome. So it's a women's health condition. It affects 1 in 5 individuals assigned female at birth. And as well as being the #1 cause of infertility, it's actually a significant risk factor in almost all health-related killers of women. So we're building the first new option in almost 70 years. Our platform combines a bioelectronic, which alleviates the metabolic and hormonal symptoms of the condition. And then we put that together with a digital platform with the goal of helping close gaps in information, diagnosis, and care.
You made a very bold claim that I'm curious to learn more on. Can you talk a little bit about this connection between PCOS and these mortal challenges that women face in healthcare?
Yeah, so traditionally PCOS was treated like a reproductive disorder, and it is the leading cause of infertility. It's responsible for about 70% of cases of anovulation, so failure to ovulate. But that has completely overlooked all of the other sides of the condition. So about 95% of people who have PCOS who are overweight have insulin resistance, about 75% of those who are lean. And so when you follow that through in terms of cardiometabolic risk factors, brain health risk factors, there's also things like gut dysbiosis and inflammation, which is core to the conditions. You've got autoimmune conditions. Basically, what do we hear today, right? Maternal health crisis, obesity, diabetes, Alzheimer's, and then certain types of cancers as well. And so PCOS is a risk factor for all of that. So yeah, we want to raise awareness, obviously, as well as providing people with different options.
Amazing. And for the HealthTech Impact Showdown, you were talking about and pitching your new LoOop product, right?
Yeah.
Can you introduce us to that solution and what you were talking about in the showdown?
Yeah, so there's two sides to the platform. So one is a device which it's a bioelectronic, so it uses low frequency electrostim. Basically, she's proven that this specific stimulation protocol helps with the metabolic symptoms, so it brings down that insulin resistance, and also some of the hormonal symptoms. So it does things like improve your menstrual regularity. And then to go alongside that, recognizing that there's huge issues, there's like a 70% diagnostic gap in this space, we're putting together a digital platform. And so, unlike others, we're really trying to give people the tools so that they can better advocate for themselves, better understand this chronic condition for themselves, become experts themselves, right? So they can access the standard of care that already exists. So things like tracking symptoms, but using clinically validated scales, right? So a doctor can then make sense of the data that if an individual wishes to share that. So that's the solution.
Amazing. And the electronic stimulation, is that happening like on the abdomen? Is it body specific?
Yeah, so the research was done on like multiple traditional acupuncture sites, but we've already done kind of informal preliminary human studies, and we're just kicking off our pilot formal clinical study. Yeah, it's like a patch that you'll wear on the lower abdomen. The protocol for the PCOS is 3 times a week for 30 to 60 minutes. And yeah, it works over time, but you start to see kind of some of those latent effects when you use it over a few weeks.
The different areas that level of stimulation and engagement into the different parts of the body systems is absolutely fascinating. Claire, it seems like you've been building a lot, and you've already mentioned a few things that are in your roadmap and that you're working on upcoming. Let's talk a little bit about the glow up that you're working on at Neuraura or with LoOop. Right, a glow up is a notable transformation. Sometimes it's a rebirth, but maybe not this early in an idea. What are the big 6-month goals, the big audacious 6-month goals that you're working on at Neuraura and with the LoOop project?
Yeah, so that pilot is definitely one of them. And that's really kind of what we see as unlocking the next round of funding so that we could obviously get that device through the FDA and into market. On the other side, we have a prototype like beta of our app out there. And in the next few weeks, we'll be adding that journaling functionality and also our AI chatbot. So, we have, hundreds, thousands of pages of content, right? Because we were big on science-backed content. And so our chatbot will then turn that into a conversational tool so that people can ask questions and get reliable answers. Because I think that's what we all want when we're dealing with a serious health condition.
Amazing. I love that sort of staged approach, right? Getting approval, FDA approval for a device can often have, many rounds of review and testing, and right, you need that data. And so being able to leverage this research, this body of work, all of this data that you already have that's driving the tech side and using AI to then empower patients now seems like a lovely use of this data set that you have both now and in the future application. Very gorgeous. Amazing. Claire, I got really excited. Claire, I love to ask, right? The road of innovation is never a straight one and usually requires some well-timed advice at least once or twice. I'm super curious, what's the best advice that you've got on your entrepreneurial journey, whether it's technology, the clinical side, patients, or otherwise?
I was thinking about this and I feel guilty because I can't remember. I'm sure it was one of our early investors that gave us this one, but it's really been part of our mantra. You know, when we bring on new team members, when we talk about how we do things, when we kind of have to kind of pull ourselves up, right, when things don't go according to plan. And that really is, there's two ways to win and only one way to fail, right? So if you lose and you learn, that's still a win, right? So, you know, what we're doing is hard, right? Like it's a complex condition. We're in a tough space. We're doing hardware. We're doing neuromodulation. You know, there's many things we have to learn on that journey. And so the best way to learn is to make mistakes, right? To try things. And I think that's kind of been just like such a part of our culture. And I think from a personal standpoint, you know, it's tough being a founder sometimes. So I think kind of just taking that as well, right, into your life, right? Life happens for you, not to you, right? Like, you know, just viewing as much as you can the kind of bumps and diversions along the way as that's the point, right? Like that's the good stuff, that's the meat, and that's kind of, you know, to see it for what it is.
Oh, I love it. The bumps along the way, the journey along the way is what makes this innovation game worth it, right? And how quickly you can learn and enjoy and absorb every inch of that path is really one of the big challenges and delights. Love. Claire, it's been so lovely getting to know the work that you're doing. I'm curious if people want to learn more, if they want to be a part of early testing, how can people get involved and get in contact with you?
Yeah, for sure. So if you want to learn more about product and try out the beta app, it's getloop.com with 3 O's. You know, feel free to reach out to me on LinkedIn. I'm pretty prolific there. And I also have a Substack where we share some of those deep dive articles, right? If this is a topic you're interested in, then find us over on Substack as well.
Claire Dixon, co-founder and CEO of Neuraura, announcing their new LoOop as a winner at the HealthTech Impact Showdown. Congrats on the win, and good luck on building over these next 6 months. I hope you'll keep us in touch.
Yeah. Thanks so much, Nathan. It's lovely to meet you. Thanks for giving me a boost on a Monday morning, too.
Awesome. Thank you. This is another special installment of our series celebrating the winners of the HealthTech Impact Showdown. And today I've got Alex Koshykov, CEO and co-founder of YODD.
Yeah, thanks so much for having me, Nathan. And I'm really honored to win this award, and I'm happy to talk more about it.
Amazing. Could you introduce yourself and the award-winning work that you're doing at YODD?
I've been in health for probably the past 15 years. I've been building mostly tech solutions for all kinds of startups and organizations, mostly in healthcare and wellness. Anything starting from mobile apps for patients with specific diseases, clinical trial platforms, telehealth solutions, and many, many other things. After my co-founder and I, we created this tech consultancy firm 9 years ago. We thought that we learned so much from startup founders that we worked with. So instead of just building only tech solutions for others, we thought it's about time for us to build some tech solutions ourselves and try to avoid all the mistakes that other startups did. Obviously, we failed in that. I think we're making even more mistakes than any other startup is doing. So that's an interesting experience. So yeah, one of the spin-offs of this company, of the tech consultancy company, is our medical device startup called YODD, Your Online Doctor Diagnostics, which is a hardware medical device, multimodal device that consists of stethoscope, otoscope, thermometer, pulse ox, overview camera, and EKG. And we're also working on blood pressure as well. So trying to measure all important vitals and biomarkers during telehealth visit. And the last thing I'd add for my short intro, I'm also co-founded one of the largest digital health communities in the world now. It's called HealthTech. It's a series of digital health events. We're now in 12 cities in the US and I think 7 cities or 8 cities outside of the US. And the community has grown super fast, probably faster than expected, which is super exciting. We love to bring innovators in the same room, share experience, share knowledge, and hopefully make some meaningful connections in the space.
I talk to a lot of innovators with interesting origin stories on the show, And you're one of the first developer to product product founder that I've met, and that journey is so lovely. I love the humility in stating that you thought you might be able to get around all of the learnings that you'll say that an early startup faces, and yet maybe found yourself in more learnings just by nature of your background and the way that you approach problems. Let's talk about YODD a little bit and the award-winning pitch that you just had. Can you break it down for us and why YODD stands out? Why you chose to go this telehealth diagnostic direction?
I think the name of the award is Health Impact Award, and we built this device specifically to bring impact, not just in the US, but all over the world. I do think there is a huge gap of, especially remotely. It's surprisingly how telehealth got basically back to numbers that we had pre-pandemic in terms of usage. I would expect, and most of the people would expect, is going to go up by a lot, but now it seems like we're still around 5 to 10% of usage of telehealth solutions. And we've conducted hundreds of interviews with patients asking why don't you use telehealth, especially after you experienced it during the pandemic? And number one reason is the lack of data. People think that doctors would not be able to diagnose you without any information. Basically, all the information doctor gets is what you tell as a patient, well, you tell a doctor. And yeah, it's not like patients are lying. Most of us don't have medical background. You don't know how well to explain your cough or other symptoms. So that's the reason why we created this solution, to bring that data to doctors during virtual visits. So doctors can actually real time listen to your lungs, listen to your heart, check your ears, nose, throat, measure pulse, temperature, saturation, and EKG and blood pressure soon. So this is the main purpose of it. And we do think there is a lot of demand on the market. Like I said, all over the world, especially rural health. I'm sure you know how rural health is struggling in the US. Lots of health systems are shutting down. And it's really a problem because people, especially in those areas, it takes them 2-3 hours to get to the hospital, and many times people wait till the last minute to do that because I don't want to, and sometimes unfortunately it's even too late. So that's why we want to bring that data real time, and you don't need to drive somewhere 3 hours to get that consultation. And as a person who got to the ER, unfortunately, 7 times for the past 3 years in the US, either for myself, for my family, or for my friends, or my host family, I can tell you, it's very time consuming. Every time we went to the ER, it was at least 5 hours of time, pretty much the whole day. And 4 out of those 7 consultations could be easily replaced with telehealth with my device, not just regular telehealth. So that's the whole mission of our company, and we are hoping to improve those numbers and bring care to patients' home, which is a new trend right now. It's kind of ironic that we're back to home health after so many years where everything started.
I have to ask, what's the model for how people access these sensors and data from the home? Are you mailing things out before an appointment? Is this a kit that people have in their house all the time? Is it connected with cell phones? Can give me a little more picture into how YODD works?
You as a patient need to have the device at home all the time. Obviously, if you get sick and you don't have the device at home, you don't want to wait for, 2 or 3 days for delivery to bring it to home. So we are thinking that all of us have thermometer at home. I think that all of us should have some, not necessarily maybe even my device, but I would hope that, but it should have YODD at home. And whenever somebody in the household gets sick, you call a family doctor, connect the device to your phone, and have a virtual conversation real time with the doctor. The second part of the question, which is an important one, how do we get that device to patients' home? If we're talking about the US specifically, because it's very different from other countries, there is no really B2C market in the space. Even if I start selling my devices on Best Buy or CVS, patient buys it and then calls his or her family doctor, and the doctor's like, I have no idea what this is. It's not integrated in my EHR, so I cannot really use that. So there is no way we can go directly to consumer. So we are B2B2C company. We are going to work either with direct primary care companies or concierge medicine, obviously working with rural health systems as well, and pediatrics is our target audience for sure. And when we talk to them, they actually have different approaches how to solve that issue. somebody's going to send that kit without device directly to patient's home and not charge for it. Somebody would actually charge for it. The good thing for me, I'm sort of outsourcing that decision to our partners on the B2B side instead of just figure out all the mailing issues myself.
I literally right before this conversation, I was scrolling LinkedIn and a friend of mine posted about being stuck at the emergency department and was reflecting about, right, how often we have these connections with our primary care. We have these opportunities to check in and get support before it's so urgent or even an emergency. And especially for these communities where travel to an emergency department or a care center might be 2-3 hours. Wow. Think about the time savings and the sort of reinforcement of why you'd want to be in better contact with primary care rather than just waiting for those several moments, those very long appointments.
But you're right, but it's also a cost saving for payers because ER visits are expensive, readmissions are even more expensive. So payers don't want people to be in the ER all the time. And we don't want that. We don't afford to pay for that as well. So that's why I think I do still have my Ukrainian doctor back home, and we do have regular consultations with my device with the doctor.
Oh, I love that. So, Alex, you've got some great foundations. You've got an award celebrating the impact that you're working toward. Let's talk about the glow up, the transformation, or let's just call it audacious 6-month goals that you're working on for YODD. What's the rest of this year look like for you?
Number one and most important task on our roadmap is FDA clearance. Without FDA in this country, obviously, I won't be able to enter the market. So this is fundraising right now, hopefully close the round soon and use most of the funds to go through FDA. So once we're done with that, then I'm good to go to start selling. There are lots of people interested in this device, lots of companies, and I already talked to a bunch of them. So most of them say, yeah, go get FDA and we can talk about our first contract potentially. So this is our next big thing for sure. But to the point, talking about myself as a founder, I think my personal goal is focus for the next few months. Like you said in the beginning, I am involved in many different things, and sometimes it distracts you from the main goal. So I do think I need to focus more on the startup if I want to bring this to market as soon as possible.
I always try to make the tech glow up about sharing actionable advice that people can learn from those who have done it before them. And this idea of when you really want something to take off, when it's time to go, even if you have lots of good ideas, taking a minute to really focus on the one that's most important, most urgent. Alex, I'm having such a good time. We're going to have to stay in touch because I want to know more about all these things that you're up to. But I need to move on in the questions. And so I want to know, as somebody who's seen a lot of different innovators on their journey, who's been that technical support to help people get over the line, and now as somebody who's decided it was time to wear that entrepreneur's hat themselves, what's the most important piece of advice that you've gotten on your entrepreneurial journey that's helped you get to where you are today?
Tough because it's hard to select just one. And actually, on one of my podcasts, which is called my channel called HealthTech, this is like the question I ask to my guests as well: what kind of advice they can give to startup founders. So I'm gonna, if you don't mind, I'm still gonna say two. One is be prepared for a marathon, not a sprint. In healthcare, nothing goes really fast. Sales cycles are long, pilots are long. Like if you're with your solution and you're planning to then exit by the end of this year, you're probably in the wrong game. So yeah, be prepared for marathon. And the second one, I think right now it makes a lot of sense to mention that as a person who is on the tech side, there's definitely lots of great things happening with AI, Cloud Code, Codex, Cursor, amazing tools. But people, I think, overestimate those, especially for in healthcare. They think they can vibe code their solution like in 2 days and bring it to market. Actually, in healthcare, that's not how it works. You still need to think about security from day one, and those solutions are not ready to build those solutions the way how it's supposed to be to pass HIPAA compliance and many other audits. So yes, building and using vibe code solutions is great. It's fun. I'd recommend, if you want to build something in this space, be aware that there are some guardrails needs to be in place, and vibe coding is great, but it cannot create the final product for you. You still need to build it according to all the guidance in the space.
Especially like in healthcare and protected industry, having a proof of concept, having like a prototype, an MVP, is often that first step to funding. And I love vibe coding for that particular moment. I think you also have to be very, very real. And there's a startup in my co-working space here at the Upstart Collective who's facing this exact thing. They got their MVP built on their own, and now they have to refactor the whole thing. And that is part of that tech investment. They got there very quickly, and now they need to take the time to do it again. If people want to learn more about all of the fantastic work that you're doing, whether it's at YODD or as a technical consultant, how can they follow up and learn more?
Sure. I'm pretty active on LinkedIn, so it's Alex Koshykov. You can find me pretty easily. And also, our tech consultancy website is beaky.io, and the YODD's website is yodd.health. So pretty easy. So if you want to see a demo or check out our device, shoot us a note. Happy to get back to you as soon as possible.
Alex Koshykov, making rural healthcare and remote healthcare more effective, more efficient, and keeping people out of unnecessary visits to the ER, while possibly transforming 3 or 4 other problem areas within the health tech ecosystem. Alex, I love that we barely touched on your surprise success as a community founder. I found that especially when the topic and the tone is right, in places like health tech, there's so much pent-up demand. I can't wait to talk more about that on a future episode. Congrats again on your win for the HealthTech Impact Showdown, and I can't wait to learn more.
Thank you so much, Nathan.
Amazing. Awesome. Hello, and welcome to another special installment of the HealthTech Impact Showdown winner on the Tech Glow Up. Today I'm talking with Tayaru Bayyana of SereniCare AI. Tayaru, it is so great to meet you. Thanks for joining me today.
Thank you, Nathan, for having me on this show.
Amazing. You were getting into a little bit of the background as we started rolling, but to get us started, could you introduce yourself and the work that you do at SereniCare AI?
Hi, Nathan. I'm Tayaru Bayyana. I'm the CEO, CTO, and founder of SereniCare AI. We are like a digital health startup focused on helping patients, caregivers navigate through the journey very empathetically and very patient-centric. The reason I'm doing this is I had to support my dad through his stage 4 cancer journey. As a problem solver, I could not solve the problem effectively. That hit me really hard, and I don't want that experience shared for other caregivers and patients. So how can we help everyone in the equation through the technology and engineering brain I have is how SereniCare AI is born.
Oh, wow. Can you, hearing that story a second time, just stop me in my tracks? Thank you for that, Tayaru. Could you, since you have an award-winning pitch that you just honed on the HealthTech Impact Showdown, could you share your pitch with us?
As I mentioned, the company is born through my personal experience and journey, and I did interview many clinicians, providers, nurse practitioners who are in the end of like mostly the chronic illness care journey. Everything I experienced has been reiterated by the 50 to 70 interviews I had with all the professionals. And there is a huge gap and there is a huge need to help patients make decisions, not reactive, more responsive. There is so much data which is telling the right story, which can help patients and caregivers make the right decisions in their journey. Why don't we use the data to help the patients was the question. Why are we making guesswork? Why are we doing this instead of that? That's exactly what SereniCare AI is here for. Yeah, so this is more to make the journey coordinated, proactive rather than reactive for patients and caregivers. In broader strokes, this will help save patients a lot of emotional stress, improve patient overall cost, which in turn result in less provider burnouts in the stressful moments. So our aim is to save costs for patients, time for providers. Overall, it's a win-win situation for provider, payer, and patient. The portal serves all the personas.
What I'm hearing from you echoes something that I hear from both patients that I support in my life and a number of like the clinical leaders that I've been talking to at health events like Vive and Health recently, right? We have the data. We can be making smarter choices. Why? Why in today's world of Sam Altman's, AI everything, can't we get a little bit more proactive, a little bit more personal, a little bit less reactive for everyone involved? So on the show, we talk about glow ups as a way to get into your goals for the short term, say 6 months. As a recent showdown winner and somebody who is building a company, what is your 6 months goals? What's the big milestones you're looking to hit in the next few quarters?
Yeah, the biggest milestone I want to hit is to prove the patient outcome improvements through the platform. We can achieve this through a pilot with a hospital system, which is small, nimble, and work hand in hand with the pace we are moving it. Once we prove the outpatient outcomes, once the learning is done, we close the loops. It will be like my vision is to reach 100,000 patients in the next 1 year. So the system is built. Patients can enter the symptoms. Providers can see the risk scores. They can collaboratively, human-centrically make decisions. If needed, we will bring in the therapists into the picture who can help this navigation journey in a more human-centric way. So all the pieces are coming in really well together.
Partnering on a pilot to get real data and to show how this is making a big difference for patients is amazing. We talked about how we have the data. Why aren't we making decisions about it? I love this idea that you hinted at, and we probably don't have time to get into, but that patients can be logging and working through their side of the equation, and that there are these touch points where patients and doctors can review the same notes and work more collaboratively. So Tayaru, one of the questions that I just love to ask innovators and entrepreneurs is, what's the most important piece of advice that you've gotten on your journey, either from like a mentor, a coach, somebody that you admire? What's the best piece of advice you've gotten so far on this journey?
Yeah, fail fast, learn quickly, grow every day, every minute, every second. Yes, that's like the golden tip I got, because time is money. The decision making gets delayed and it feeds back into the company, and that delays the traction. So yeah, learn fast, quickly make decisions, and grow day in, day out. That's what I encourage every one of my team members.
How do you personally ensure that as a leader and as somebody who is, pulling all these levers within the company, how do you make sure that you stay focused on that growth and learning every day?
I am a learner by doing. So, for example, I am doing the in-person interactions with C-level for a pilot launch. The thing that's I come from a corporate world. I never did this. Every interaction is a learning for me and for the company. I talk to everyone with open mind. What is the feedback they're giving? What I can learn, what the company can learn, and how we improve day in, day out before we have the next conversation. So,
Oh, warms my heart. One of my most common pieces of advice is, right, like if you have a question, go ask your customer. And that like the CEO, CTO is out there leading in the trenches, right? And it doesn't sound like it's one of those like task heavy, has to be involved with everything, but like I need to understand these core partners, these people who are going to move our vision and right modeling that for the whole team. Amazing. I'm so glad I asked the follow-up. Tayaru, we're basically at time. So how can people follow up with you and learn more if they want to learn more about what you're doing at SereniCare AI?
yeah, I am on LinkedIn. Anyone who would like to see a demo of the application, please reach out to me. I will set aside time on my calendar. I would love to show what we have at this point.
Well, thank you so much for joining me today on the special HealthTech Impact Showdown Award Winner Series. It's such a pleasure to get to meet you and the work that you're doing at SereniCare AI. Congratulations again.
Thank you so much, Nathan, for giving me this opportunity. I'm humbled to be on the show.
Thank you.
Thank you.
Can I ask you a favor? If you really enjoyed this episode, could you share it on your Instagram stories or maybe post the link with what you enjoyed on LinkedIn? This sort of sharing and engaging really helps small podcasters like me reach the audience that I know really cares about these kinds of conversations. If you've made it this far in the podcast, I really appreciate you. Thanks for listening. Please make sure to like and subscribe so that you never miss an episode of the Tech Glow Up audience that I know really cares about these kinds of conversations.